Good afternoon. This is group 2 once again. We were supposed to demonstrate how to prepare the doctor's office. So as this is our doctor's office, and we've set all the equipment and the requirements that we need. With me, we are having a thermometer, a gun thermometer to measure the temperature of the patients once they come in. First thing is to measure their temperature to know if it's normal or it's just above. It's above 36.5. We're having a stethoscope to measure their heartbeat and get to know how their heart is racing, if it's okay, or if they're sick, we'll know by the heartbeat. We're having the machine to measure their pressure here. As you know, you cannot treat a patient without knowing how their heart is beating, their temperature, and also their pressure. So before touching the patient, because most of the time as a doctor you have to touch the patient, before touching the patient, as a doctor you have to wear your gloves. Here with me I have gloves. So the doctor always has the gloves in the drawer or somewhere. Then we are having the note here, or a record, a patient's record here. So it has the patient's name, their age, their number, and their sex, and the symptoms that they're showing. You record here. Also, we're having a record here. If the patient was treated in that hospital or by that doctor, they tend to have their records here, and you can go to the record and read what the patient was suffering before today. So we are also having posters around the doctor's office showing the body parts and the muscular system, also the medicines that we may be using. We're also having a procedure to wash the hands. As you know, washing of hands is something that's very crucial when doing everything. Make sure you wash your hands after and before. We are also having some medicines here. So these are just a set of medicines that you might be needing or not needing. You might be needing or not needing. So once you've seen your patient and you've seen the symptoms that they are showing, you might have to recommend or prescribe medicines for them. And here is a set of medicines that you might be using. We're also having cotton here and some syringes. So in the event that you need to inject the patient, you'll need some syringe. Here is a sample, and another one is here. We're also having a cotton wool to put spirit before you inject the patient. We're also having a weighing scale here. We also have to weigh the patient's weight before you proceed and compare if they have gained more weight or lost weight. And with me also we're having a dustbin here. Once you've injected the patient, you have to dispose well the needles that you've used. So you'll make sure you dispose them here. And normally it's always a dustbin that we use a pedal. You don't use your hands when you're opening the dustbin and closing it. So in a good scenario, we'll be using a pedal dustbin. That's it. We're also having a laptop here. You can key in the patient's info for future reference and also for record keeping.
Okay, after this station, we move back to this station. On this station, we have a patient's bed. As you all know, in order for a doctor to examine a patient, there must be a patient bed, and it is a little bit reclined on the upper parts. And right here, we are trying to make our patient feel comfortable, being that it is a festive season. We incorporated some Christmas theme for the patient. We also have water, and we just have some flowers to make the patient feel comfortable and feel more sooner. On this far end, we have our drip and our thing to hold the drip in case the patient will need to be admitted just for a day. But if it's for the whole day, the whole night, there are some wards in the back area. Right here we have a seat and a coffee table with fruit, with a fruit basket and some fruity mix. That's all about our doctor's room.